Namaste. Thank you for joining us here on SLG HELLO DOCTOR, a fortnightly virtual digest of health information. Most of us would have seen or heard of friends or family members dislocating the shoulder joint, which as laypersons we know to be a ball and socket joint. At times, the ball slips out completely from the socket and at times partially. In some people, this happens quite frequently. Today, we will understand from Dr. B. Chakradhar Reddy, Consultant Orthopaedic Surgeon at SLG Hospitals, Hyderabad, the why, how, what, and much more about the condition called recurrent dislocation of shoulder. Dr. Chakradhar, welcome to SLG HELLO DOCTOR and thank you so much for joining us here today.
Okay, it's my pleasure, ma'am.
Shall we get started, doctor?
Yes, we can.
Why is our shoulder at all so prone to dislocation? And what is recurrent dislocation?
Shoulder is a ball and socket joint. Basically, like a hip, shoulder is also a ball and socket joint in our body. In the evolution, we need mobility. So, shoulder has been modified into such a way that the socket became small and ball became big. So that we will be able to do most of our mobility activities. In fact, shoulder is one of the joint in our body which can be very mobile compared to other joints. That's because anatomy has been evaluated over the time to get the mobility. But we won't get the mobility just like that. We have to sacrifice the stability of the joint, and that exactly has happened to the shoulder joint. So shoulder joint is much prone for dislocations because the stability of the shoulder joint is mainly dependent upon the muscles around it, and the socket is small, the ball is big, and we move a lot in the shoulder in awkward positions. These three will contribute for recurrent dislocations or dislocation of the shoulder, which is very common compared to hip or knee or elbow or other joints.
What is a recurrent dislocation, doctor?
Just now I was telling about the shoulder stability is less. So shoulder gets dislocated easily, and when the dislocation happens again and again, it's called recurrent dislocation. More than two is called recurrent dislocation. So the shoulder, why it dislocates easily means the shoulder joint is a ball and socket joint, as I previously mentioned. Once you dislocate, you will damage a part of your socket, and that socket will have a bumper. The bumper type of thing is called labrum. The labrum will be peeled off when the shoulder has been dislocated once, and once the shoulder has been out of the socket, when we pull it back in, the bumper won't heal properly to the socket. So that makes it more prone for recurrent dislocation, or the shoulder keeps on coming out again and again each time when the patient does abduction and external rotation. The position of the shoulder is like this, the shoulder will come out because this is the position when the dislocation happens more oftenly. That is very common, and that's called recurrent dislocation of the shoulder.
Doctor, I remember that an office colleague once said that when her husband picked up her son by one hand playfully, the shoulder actually came out and they had to push it back. So is this very common in kids?
It's very common in teenagers though. It's not very common in kids. Kids, in fact, shoulder dislocations are very rare. But in adolescents, like people who are 16, 17, when they play a lot, when they are more active in their life, so those people are more prone. And dislocations of the shoulders are common in younger age group than in the older age group, but not in children. Children, of course, that's a very unfortunate thing for that kid, but normally it's not that common at all.
What kind of activities can lead to dislocation of the shoulder?
Activities like throwing, activities like playing shuttle, overhead activities like repairing something on the roof, mainly like playing cricket or volleyball. These are the sports mainly are the main reason for the dislocation of the shoulder, because the shoulder should be above the, if it is more than 90 degrees, then it is more prone for dislocation, and on top of it, if you rotate the shoulder and keep smashing the ball or keep this type of activity, the shoulder is under immense pressure and it can come out when the patient is more prone for the dislocations.
So doctor, that means all our Wimbledon players, our Sania Mirza, our Saina Nehwal, all of them at some point would have been very susceptible to something like this, like dislocation or recurrent dislocation?
We should be clear in this, like dislocation, once it happens, happening it again and again is very easy. But first time dislocation should be having a specific reason, like a trauma, like a overhead activities like playing basketball, shuttle badminton and stuff. But not everyone in the world who plays badminton, who plays shuttle basketball will be having a dislocating of the shoulder. There should be some patient factors as well along with it. Some people will have very stiff joints, some people will have very lax joints. People will have a lax joint are more prone for dislocations or subluxations. So not that Sania Mirza haven't got a dislocation, luckily it doesn't mean that overhead activities athletes would not be having dislocations all the time. But first time dislocators are very prone for the second and third and more dislocations, which is very common. So first dislocation we should avoid it.
Is there a surgical solution to prevent this condition from happening, doctor?
Recurrent dislocation is not a recent thing. It's been evaluated, it's been treated from many years in the medical practice, especially from the shoulder surgeons. We have evaluated and evolved and found the pathophysiology of the dislocation, and the imaging, especially the MRIs, found out exactly what's happening with the shoulder after many dislocations. So people have attempted many surgeries in the past and with various degrees of success. Like in the beginning they used to do putti plat. It's like a tightening of the muscle in the front so that the shoulder won't be going in that position, but at the expense of loss of movement. So that was the oldest one which was successful at that era. But nowadays we are not doing that anymore because more advancements came, and what I normally do is arthroscopic Bankhart's repair. So that is everything under keyhole surgery, no scars, no stitches, once daycare surgery, and we will be able to repair the bumper. As I told you before, when the shoulder is being dislocated many times, the front part of the bumper is completely smooth and the bone is very polished. So each time when the person does that, automatically the shoulder will dislocate without his notice, and sometimes it can happen in sleep also. So to prevent these things, we have to repair the front of the socket with the bumper which has been pushed back because of the multiple times of dislocation. So we are able to do that with special anchors which will go into the bone and suture it back until it unites in the place where it should be and give stability to the front so that the shoulder won't be dislocating. I have done almost 500 to 600 recurrent dislocations of the shoulders arthroscopically with a very good amount of success. More than 90 to 95% of them will be very successful and very happy with these surgeries. And if you see a person who had hundreds of dislocations and there won't be any socket remaining, half the socket might have been absorbed because each time dislocation a 5 mm of bone will be going away. So likewise, if you keep on dislocating and neglecting the thing, the socket won't be remaining as it was in the beginning. You would have got only half of the socket remaining, and we can't repair that with the surgery just I told you, like stitching the socket with the labrum which is remaining behind. So in that case we have to build the socket with a bone piece taken from the front of the joint and then screw it so that the socket will be more concave and more bigger, and then the shoulder will be more stable. So it's a much complicated surgery. It's called Bristow surgery or lethargy surgery, but this is done mostly open, not arthroscopically. So I advise you all guys who have a recurrent dislocation, it means more than 2 times or 3 times, consult the shoulder surgeon for needy treatment, because if you dislocate many times, it's going to be very difficult for me or other shoulder surgeons to correct it arthroscopically. But if it is dislocated maybe 2 times or 3 times, when the damage is not heavy, then we can very easily repair it, and the repair would be a very high success in this practice. I advise you guys to come quickly and get the treatment. It is a day case surgery. Maybe the surgery will take an hour or so, and the patient can go home on the same day, and by 6 weeks the patient will be completely normal.
It's break time on SLG Hello Doctor.
ప్రపంచ స్థాయి మల్టీ సూపర్ స్పెషాలిటీ హాస్పిటల్ SLG Hospitals. 4 ఎకరాల సువిశాల ప్రాంగణంలో 999 బెడ్ల సౌకర్యంతో గ్లోబల్ జేసీఐ అండ్ ఎన్ఏబిహెచ్ ప్రమాణాలతో అనుభవజ్ఞులైన వైద్య నిపుణులతో అత్యంత క్లిష్టమైన గుండె సమస్యలకు శస్త్రచికిత్సలు చేయబడును.
మెదడు మరియు నరాల సంబంధిత సమస్యలకు మొట్టమొదటిగా న్యూరో నావిగేషన్ టెక్నాలజీతో చికిత్స,
క్యాన్సర్ చికిత్స కోసం లీనాక్ వంటి అత్యాధునిక వైద్య పరికరాలతో చికిత్స,
కీళ్ల నొప్పులు, ఎముకలకు సంబంధించిన సమస్యలకు మరియు జీర్ణకోశ సంబంధిత వ్యాధులకు మెరుగైన వైద్యం అందించబడును.
20 అత్యాధునిక ఆపరేషన్ థియేటర్లు, 200 ఐసీయూ బెడ్స్, అత్యాధునిక డయాలసిస్ సదుపాయం కలదు.
24 గంటలు ఎమర్జెన్సీ, డయాగ్నోస్టిక్, ఫార్మసీ సేవలు,
3 టెస్ట్ల ఎంఆర్ఐ, సిటీ స్కాన్ వంటి అత్యాధునిక వైద్య పరికరాలతో మరింత మెరుగైన సంరక్షణకు మీ ఎంపిక ఎస్ఎల్జీ హాస్పిటల్స్, నిజాంపేట్ రోడ్, బాచుపల్లి, హైదరాబాద్.
సెల్ నంబర్స్ 9133395500,
ఫోన్ నంబర్స్ 914023785678 మరియు 48525678.
టోల్ ఫ్రీ నంబర్ 1800599220.
ఎమర్జెన్సీ 7799235678.
ఆంధ్ర ఆరోగ్యశ్రీ సదుపాయం కూడా కలదు.
Welcome back to SLG Hello Doctor. We are talking to Dr. B. Chakradhar Reddy, Consultant Orthopaedic Surgeon at SLG Hospitals, Hyderabad, about recurrent dislocation of the shoulder. Doctor, what are the side effects to be considered from this surgery, and what is the post-op care and rehabilitation program like?
Any surgery will have side effects. If I say it's 100% success, it is wrong. Definitely surgeries are having some sort of risk. Having said that, one of the surgery which got least side effects because the patient is young, he'll have high immunity, and we are doing keyhole surgery. The scars are minimal, so the infection rate is very, very less. Normally any surgery will carry around 1% infection rate, but in here the infection rate will be even 0.1% as well, so it is negligible. So the second common side effect is important. So the shoulder can redislocate again after a successful surgery. So that can happen after a fall again, which can happen, or after a failure of the repair. So that can also happen. This recurrence of the dislocation of the shoulder after surgery is called a complication of the surgery, or it's just a process of the surgery. This is around, if we put together all of them, this will be around 1% to 2% out of 100. So that also is not huge. And very rarely when we do this surgery, there are some nerves can be stretched. So you can temporarily get some sort of weakness in the shoulder that can be resolved by itself in a week or two. So nothing to be panicked about it. Basically this is a very straightforward, very highly successful, least side effective surgery compared to other open surgeries like knee replacements and all, which have high infection rates.
You did mention that there could be instances of redislocation after surgery. So at all, is there a possibility of full recovery, and how long would that take?
Full recovery after the surgery, I will explain you in a phased manner. So when I do the surgery, on the day of the surgery, patient will be having an immobilizer of the shoulder, means the shoulder would be held close to the chest so that the repair won't be disturbed. And after the surgery, for about 5 weeks, the patient has to keep the shoulder close to the chest so that the healing will take place inside. And after 6 weeks, the patient will start mobilizing with the help of the shoulder physio, and then by another 4 to 5 weeks, the shoulder will be fully mobile, and say that is around 2.5 months to 3 months. So now the shoulder is able to be mobile as normal as it was before. But to gain the strength of the shoulder or to go back to the sports activities, you have to train the muscles around the shoulder, and that is called rehab. That rehab will take around 2 to 3 months. So you have to wait for good 6 to 7 months for you to go back to the sports and play overhead activities which are very vigorous and which gives a lot of strain on the joint. So the rehab process is long, but the recovery for normal activities is around 8 weeks to 10 weeks, not more than that.
Highly obliged, Dr. Chakradhar, for explaining the condition and the facts so simply and clearly. I'm so glad to have had you on SLG Hello Doctor.
Thanks a lot everyone who is patiently listening to my advices, and be healthy, be positive, and don't neglect your condition, and come to the doctor as soon as possible so that we can be in a better position to help you quicker. Thank you.
On behalf of the teams at SLG HELLO DOCTOR and SLG Hospitals Hyderabad, I wish you all a very happy, healthy and prosperous New Year. We'll see you back here in 2022. Until then, be aware, be safe, be healthy. Viewers, don't forget to hit the bell icon to keep yourself updated on all that's happening at SLG HELLO DOCTOR.